Hello, everyone. Welcome back to the final day of today's housing conference. I'm Morgan Anderson. I work for Poitou-Gajing Niaging Advisory Services, and we serve 7 First Nation communities. And today I'm here to present Jordan Dickerson. Jordan Dickerson is an environmental public health officer for the First Nations Inuit Health Branch, Indigenous Service Canada. Jordan has worked with the First Nation in Northern Ontario for the past 4 years. Prior to working with First Nation communities, Jordan was a public health inspector at Ottawa Public Health, Sudbury, and districts of Algoma Public Health. Jordan attended Ryerson University in Toronto and was successful in his Bachelor of Applied Science, Public Health with a minor in politics. He is a member of the Certified Public Health Inspectors of Canada. Jordan, with his wife Selena, daughter Ava, and dog Bruno, currently reside in Timmins, Ontario.
Good afternoon, everyone, and just going to share my screen. And yeah, I hope everyone is enjoying the conference so far. I mean, yeah, thanks Morgan for the introduction, and yeah, it's a great opportunity to be just connecting with everyone and just continuing the work that we're doing in our communities, and hopefully getting a lot of the housing projects that may have been derailed for some time due to kind of this pandemic, that hopefully this spring some of these projects can continue to move forward. And yeah, today I'll just be speaking on mold and radon and just some of those public health issues that we see in First Nation housing. And yeah, so we'll be covering those topics. And so I work for the First Nation Inuit Health Branch, and we, yeah, so we provide public health programming and services, either directly providing that service to the community through us as inspectors, or through different funding agreements and projects with communities and other First Nation organizations. So some of the funds and the projects that we deliver is community-based health promotion and disease prevention programming that we'll dive into, some primary home and community care services, service to control communicable disease and environmental public health issues, and that would be through our food and water inspections, and also direct support with non-insured health benefits for community members to get the health care that they need, especially if it's not in community. So environmental public health program works to identify and prevent environmental public health risks that could negatively impact the health of First Nations communities and their residents by providing corrective action and providing that support to reduce the risk in the community. So some of our guiding principles, we work with First Nation communities as active partners in environmental public health program. So we collaborate with public health workers, provincial and local health authorities, First Nation organizations, and other federal, provincial, and municipal departments and agencies when delivering public health programming to the First Nation. So we work with the community, the chief and council themselves, the tribal councils that they may be connected to, and also working with the public health agencies and the local health units that may be in that surrounding area. And we also strive for a level of on-reserve environmental public health services that is comparable to that that is provided by the provincial health units within that region. So the role for us as environmental public health officers, or EPHOs for short, as we were formerly just environmental health officers, But with the change from going into Indigenous Services Canada, there was that kind of difference with the environmental officers. So providing that public health kind of highlight in our title helps kind of bring things into perspective for what we do. And that includes providing guidance, education, completing health inspections, and providing recommendations to the First Nation to help manage public health risk that is associated within the environment. So we gather data and analyze what steps can be taken to promote public health in the First Nation communities. So that can be some of our standard stuff, and as well as if specific issues arise in a community, we can provide that support and get some of that data if sampling is needed, for example. So we also can be employed by ISC through the First Nation Indian Health Branch or through First Nation organizations. As we've seen, a number of areas in the province now have gone through devolution, so they actually hire our specific role to provide those services under that programming. So in all PHOs, we all have to be certified by the Canadian Institute of Public Health Inspectors. So as Morgan mentioned, I went to Ryerson University to get that public health degree. And then also, similar to nursing, we have that certification process after the degree program, just to confirm our competency as professionals. So here's a map of the province and where we have environmental public health officers located. So the orange circles you'll see are kind of where our main hubs are. But we also have one EPHO in Sault Ste. Marie, two covering the Sudbury area. And then we also have our inspectors throughout the southern zone that typically work from home, because traveling from Brantford, all the way to Ottawa, that'd be a long commute for a day's work. And so some of our core programming, as I mentioned, is drinking water, and that's always kind of been what we've been known for, especially in our communities. They see the face and they call us the water guys. But typically we provide a lot more than just water sampling, such as food safety inspections for the local restaurants, grocery stores, and also in the school and daycare settings to make sure that food is being prepared safely. Today we'll be talking about health and housing, but we also look at wastewater for communities that have on-site septic, solid waste disposal. We do facility inspections, such as arenas, community centers, as well our community disease control focus with anything from foodborne outbreaks to obviously our role in the current pandemic, and emergency preparedness and response. Working in the James Bay coast, we know that some of the communities have issues with flooding, so making sure that they're prepared for when that occurs, sometimes on an annual basis, working with that team to make sure that the community is informed and mobilized if things do become a problem. So environmental public health officers, our role specifically for health and housing. The activities that we do is the inspections of homes. So we go through a request process where either the individual living in the home or the community themselves will want their house assessed if there's a mold issue or examples of overcrowding and other issues in regards to homes, so pest control, any structural issues, and just general safety, so electrical and fire and so on. We also like to be involved in reviewing of plans. So when a new restaurant, for example, opens up in a community, we go through that planning process to make sure that they have enough sinks, that they have adequate space for storage, and making sure that they're using the right products to clean and sanitize surfaces. And in general, we provide guidance and recommendations if chief and council ever have any questions. And we like to be involved in all three phases of the building process. So site, choosing a location, the design, what the space is going to be used for, building, and then occupancy. And in some instances where there's been a degradation in the site or the home, then we would provide comment on demolition. So we provide education as well to chief and council and as well as homeowners to make sure that they can maintain a health and safe home for their family and for themselves, and training. So using platforms like this, and as well as being able to provide resources to housing directors, we can provide that support to have training for homeowners to take care of their property. So we'll first dig into mold. And in this section, we'll look at what is mold, what the conditions are needed for mold to grow, some of the health effects, how we complete an investigation, what are high risk areas for mold, what are the control measures that are in place, and then some tips for mold prevention. So we can see mold will pretty much grow anywhere where there's moisture and organic. So we can see it just when we're outside in the ground. We'll typically see it, here's an example of grapes where mold can grow, as well on other fruit. And as you can see, in an ideal condition, all types of mold with the right opportunity can grow. So you can see that there's a wide variety of them in that petri dish. So mold is a common word for any fungus that grows on food or organic materials. Mold can be black, white, almost any color. There's more than hundreds of them that can be seen, and they often provide like a stain or smudge, or provide that musty smell of just decay, really. And in order to grow, mold needs moisture and material that it can live on. So it then releases spores into the air, which are small enough for people to breathe into their lungs, and breathing in a large amount of these spores and any of their byproducts, as some of them can produce a toxin, they can impact our health negatively. So for mold to grow, we need the relative humidity to be 50% or higher. So we need moisture. We need a moisture source. So that can come from water coming into the home, plumbing leak, just condensation on our windows, and obviously if flooding occurs. We need time. So any material can get wet, but it's when it is wet for greater than 48 hours that then that mold begins to grow. And food source. So any material that, as I mentioned, is organic. So a large amount of dust, drywall, cardboard, insulation, wood, and fabrics, they can all support the growth of mold if there's enough moisture. So potential health risks for mold. So there is a relationship between indoor mold, damp conditions that can cause an increased eye, nose, and throat irritation, coughing and phlegm buildup, wheezing and shortness of breath, symptoms of asthma, and any allergic reactions. So people respond to mold in different ways depending on the amount that they're exposed to and other underlying health conditions or breathing issues that can be genetic or further impressed upon by the environment. So we complete investigations whenever there is a request made from the community. So we'll do an on-site or a visual inspection to identify damp areas where water damage has already occurred and may require cleaning or replacement. And typically most people ask, for us to do some air sampling. But we know that when it comes to because there's so many different types of mold, determining the specific mold that's there is not as relevant as determining where that moisture is coming from, when there's a greater impact on just addressing that water issue. So the best way to reduce your health risk to mold is to identify and remove that moisture source and then clean up the mold. So once it's no longer visible, then the spores are not going to be impacting, but where the walls have been damaged, we want those replaced, or else they might be growing inside the walls. So we have that high risk of mold growth when we see the example on the top left where venting is not hooked up at all. In the examples of roof leaks, especially if there's damage to the shingles, or in some of our northern communities that it just gets so cold that there's actually an ice buildup in the attic. And then when that ice melts in the spring, that water then infiltrates the home. And so that's where the insulation, vapor barrier, and that ceiling tile would have to be replaced. Dryer disconnect. So if we don't have our dryers venting outside, the center picture with the bathtub seal, if we don't have that, then water easily finds the drywall and our exhaust. If our exhaust from our HRVs, from our bathroom fans or so on are disconnected, then that moist air remains within the four walls of the home. So as well, from the outside of the home, we look at the downspouts to make sure that they are connected, obviously, and making sure that that water is moving away from the house, and also looking at the foundation, because if there's cracks or the ground is moving in towards the house, then that water is going to go into the basement. So windows are a common concern, especially with the condensate on surfaces due to excessive humidity in the home. And when that cold air and that warm air meet at the window, you're going to have that water there, and that can be due to lack of ventilation or low temperature, like I said, outside, and then meeting. So that can result in mold growth, especially if you've got a little bit of dust there. When that water is introduced, then mold will grow. But typically just giving that a wipe will help remove that. So a problem that we see in a lot of homes, again, is just the leaky plumbing. We know that the concern with not having a lot of plumbers in a community, you can see the picture on your left where, someone used a little bit of duct tape to at least minimize that water dripping under the sink. But as you can see on the back, that water has been a concern for a while. And so there's a large amount of mold growing in the back. And then same thing, the other picture on the right with using electrical tape. These are good short-term solutions. Sorry, but long term, we want to make sure that a plumber would come in and properly seal those pipes. So again, for us, we want to make sure that we're moving air as much as possible. And so when our bathroom fan looks like the picture on our left, that fan isn't going to be able to move that amount of dust. So making sure that those are kept clean and clear so that air can flow definitely reduces the moisture when you take a shower or a bath. And then photo on the right, or for the HRV inlets, we want to be bringing in that fresh air. We want to make sure that those are clear as well, so we're not bringing that material inside the home and the air that we're going to be breathing. And then in the top right, our dryer vents. You know, you always find lint everywhere, and so making sure we clean those traps, and even in the fall or spring, you know, using a vacuum to kind of get some of that out will help the air circulate. So for control measures and remediation, first we want to try and find the source of our moisture. So like I said, if the foundation's leaking, or if we've got a leaky roof, then we want to fix that roof first so that we're not continuing to introduce water into that environment. Before beginning any mold cleanup, we want to make sure that we don't expose ourselves to the mold. So that's where we recommend wearing personal protective equipment to make sure that we're wearing an N95 mask, using safety glasses, goggles, and rubber gloves so that we can wash any of that material off ourselves. And when that work is being done, we want to make sure that any vulnerable populations, so our elders or our young children, are just not in that space when we're disturbing or ripping out that material. And so for small areas that are less than 1 square meter, that's something that a homeowner can manage by just putting on some protective equipment. You know, we suggest wearing a long sleeve shirt, putting on a mask, or at least something to cover your mouth, goggles, and rubber gloves, and then just preparing a water and soap solution. There's no need to add the bleach in there. And then have a second bucket with just clean water to get that residue off. And so you can use detergent, or you can also use baking soda and water if that's all you have, to clean the surface. So we want to wipe the surface with the soapy water. We want to sponge it clean with just the water. And then we want to make sure that that wall doesn't get too wet. So we want to damp it down, maybe even have a fan running in that space to make sure that it dries adequately. And then replace any material that's damaged. So if you see that there's, you know, bubbling on the wall, or if you press on the drywall and it's very soft, then you'll want to cut out that area and replace it. So for medium areas, especially if it's kind of patchy, you can, again, follow those steps to remove it. And that's kind of, as long as it's smaller than 3 square meters, then those same steps can be followed. But in that event, you may want to consult a professional to make sure that that damaged area is taken care of properly, and any other issues that might be found once you start ripping out the drywall can be addressed at that time. And anything greater than 3 meters squared, we want to make sure that a contractor would come in, because with that kind of volume, you want to make sure that that material is disposed of, and the minimal contact for handling is done. Yeah, and same thing, whenever you're handling it, you want to be wearing personal protective equipment. And again, making sure that any issues that you find when you start removing that material are addressed. So if the vapor barrier needs to be repaired, you know, insulation put in, and any other electrical issues or so on that are found to be addressed. So how to prevent mold. So when you see water or moisture, you want to report it, especially if your home is owned by the band, let the housing director know so that they can send someone out maybe to fix that leak quickly. And if you can, address the water yourself. So it's not sitting there wet for, as we said, longer than 48 hours. So actively, you want to check your home foundation, walls, windows, roof, plumbing, tubs and sinks wherever water is, to see if there's any spills, and make sure that area is dry. Check windowsills regularly for condensation or moisture, particularly in the cold. And if found, you want to act quickly, as mentioned, drying it off and doing that. I know I just bought a house last spring, and I'm learning this spring all about water. And so it was in my basement, but by using a shop vac, a dehumidifier, and using a fan to dry out the area, I didn't have any mold growth on my newly renovated basement. So the big key, as I said, is ventilation. So if you can turn on an exhaust fan or open a window, obviously that's not the case in the winter when showering or cooking, but making sure that we're moving air. You want to check clothes dryers and bathrooms to make sure those fans are operational, and if possible, have them vented to outside, so that air isn't circulated back into the home. And when necessary, obviously open windows. And if you are fortunate enough in your home to have an HRV system, then turn it on and use it. It helps balance out the air in the home and definitely remove a lot of the moisture. So other keys for your home is to make sure that your home is warm and that the air is circulating. So again, checking our fans, and making sure that in rooms or areas that have become cold, that can encourage condensation to form. You want to make sure that you pull out your bed from any walls that are cold and just allow that air to be able to get behind, and then you won't have those little spots of mold behind your dresser or bed, for example. And exterior walls, again, where cold air meets warm air, that's where we're going to have that little bit of moisture. So when we can keep that space dry, then we're not going to see any mold grow there. So again, remove items that may cause mold. So reduce the amount of materials stored, especially in the basement or any crawl spaces. We want to throw out wet or badly damaged or musty smelling items. You don't want to store firewood inside the home, because as that wood dries, it's obviously creating moisture in the air. Remove carpet from bathrooms and basements or anywhere where there's going to be water introduced. It's very helpful. And remove clutter and take out garbage regularly as well. So we want to prevent water from entering the home. So install a downspout extensions to take rainwater and melted snow away. Make sure eaves troughs and roof gutters or downspouts are connected and they're not clogged by leaves or bird nests or anything. And just monitor them seasonally, and make sure the ground slopes away from the foundation. So ideally a 45-degree angle from your foundation outwards of your house by a couple feet will help make sure that that water doesn't enter into the foundation of the home. So our next section, we'll look at radon. So what is radon? So radon is a naturally occurring radioactive gas, colorless, tasteless, odorless. So obviously it's not easy to be made aware that it's in your home. And it's produced from the decay of uranium that is present just in soil and mineral rock just within the area. So it has a half-life of 3.8 days, which means it breaks down every couple days, so you can have a little bit of that gas each day. In Canada and elsewhere, radon is measured by the SI unit in becquerels or per cubic meter. And in the US, radon is measured in picocuries per liter. So there's that little bit of a difference. So in becquerels, the number is higher than in the US value. So radon is released from the soil. And as the permeability of the soil increases, so does the amount of gas that is going to come from the soil. So as uranium deposits decay, then radon gas is going to be emitted. And as I mentioned, that gas can easily go through the levels of the soil, and it's also water soluble. And can be found in the groundwater and in some of our wells that we may use for drinking water or just use to water the grass. Radon released into the atmosphere is diluted to a low concentration, but when it can make its way into our home, that's where those concentrations can increase. So how do they enter our home? So they enter the home through cracks and openings or gaps in our foundation or walls, with the air pressure inside our house normally being lower than outside. It's going to naturally come in, and the difference in pressure acts like a vacuum, drawing the radon through the cracks in the foundation and any other openings. So in the diagram, you can see, there's a well system there, so it'll get in through the well, brought into the home through the piping, and emitted through the shower, sink basins, and so on. And once inside the home, radon can build up to dangerous levels if we don't have that air circulation again in the home. So what factors affect radon levels in a home? So indoor radon levels vary greatly, especially even within a 24-hour period. And in the summer, obviously we're opening windows more, we've got the air conditioner moving, so we're moving a lot more air. But the amount of uranium in the ground is a factor. The weather, so the amount of moisture, the soil type that is around our home, foundation design and construction material used, number and size of openings in the foundation. So whether we have cracks, whether we have, a crawl space that is still exposed to the ground itself, heating and ventilation, and occupancy pattern. So how often we stay in the home. So in this pandemic, being home a lot more, that can be, that exposure level can be greater because we're not leaving for the office, for example, or traveling as much. So we're in our homes more. So and the diagram just shows two identically built houses side by side can have a different radon level, and that's just the how amount of bedrock that might be in the under the home, or how much organic material that is there. So radon and health. So radon is the largest source of natural radon exposure. The known health effect of radon exposure is the high risk of developing lung cancer. So worldwide, approximately 10% of all lung cancers are attributable to radon exposure. And in Canada, approximately 16% of lung cancer deaths are due to radon. And in Ontario, approximately 13.6% of lung cancer deaths are due to radon, which is about 850 deaths per year. And the health effects the radon has is enters into our lungs through inhaled air, and continuous and prolonged tissue damage can result in cancer development. And the risk of developing lung cancer depends on radon concentration, how often we are exposed to it, and also whether we have smoking habits that can increase that factor. So as the image shows, that smokers and high radon exposure have a 1 in 3 chance of getting lung cancer, whereas just exposure to high radon and not smoking is still a 1 in 20 chance of lung cancer. That's why radon exposure is the leading cause of lung cancer among non-smokers, and radon exposure is the second leading cause of lung cancer to those who are classified as smokers. And so this table here shows the radon level, lifetime risk for a non-smoker and lifetime risk as a smoker. So if we're kind of at that healthy range for radon level, then we only have that 2% chance for non-smokers and 17% chance if you are a smoker. And if our home has a high radon level of 800, then a non-smoker that's more than doubled their chances at 5% and 30% if they are a smoker. So the combined effects of radon and smoking create a greater risk than if you did them one of those two separately. So radon, the federal guidelines, so the newest guideline was introduced way back in 2007 with remedial measures should be undertaken in the dwelling whenever the average annual radon concentration exceeds 200 becquerels in a normal occupancy area. So the dwelling includes any residential homes, buildings with a high public occupancy rate, such as schools, hospitals, long-term care residents, and correctional facilities. And normal occupancy is equal to if we're there for longer than 4 hours in a day. So how to test for radon. So there are two options. So you can hire a certified radon measurement professional. So there are companies that can provide that service, as well as you can purchase a long-term do-it-yourself kit that are available online, over the phone, or most like home hardware retail stores that they can be purchased. And Health Canada recommends using the long-term test device for a minimum of 3 months, ideally during the fall and winter seasons. And that's because when we're less likely to open our windows and have that greater air exchange. So that'll get kind of the resting rate of the home for radon. And measurements gathered over a long period of time will provide a better estimate of the annual average exposure, because you might be, 1 week you're traveling, so you're not home at all. And other times you might be home, like I said, in this pandemic, you're never leaving the house. So that exposure obviously increases and decreases. So the longer you have of data, you can see if there's a greater concern. And then, so there's 3 types of tests. So there's the electret ion chamber, there's the alpha track detector, and there's the continuous radon monitor. So the 1 and 2, again, can be purchased in most of our retail settings for homes, whereas that continuous monitor is what is going to be used by a professional, as those require calibration and then pulling that data from those machines as well. And again, the do-it-yourself home kits kind of give you that framework of, is there a concern? And then obviously if that test does come back with high levels, then you would want to call in a professional to set up a program as well, maybe just to confirm that data at a more accurate level. So here's just the diagram of kind of a healthy home. So 200 to 600. So if you're at that higher end of the 600, you'll want to look into some planning steps to address your home. And if you're above that 600 level, then you want to take a little bit more timely correction for your home. So how can we reduce the radon level? So if the radon level is found to be high, it can be fixed at a reasonable cost. And there's a few options that are available for homeowners. So they can hire a CNRPP certified radon mitigation professional. So they would help provide an assessment of the home and what are the steps that are going to take an immediate action on it, and what are the things that are kind of more passive. And so the most effective radon reduction method is called active soil depressurization. And that's typically done by a contractor. So other actions that can be taken to reduce radon would be establishing greater air exchange in the home. So having an HRV, for example, or making sure that all your fans are running. Seal radon entry routes, so looking at filling cracks, finishing foundation, looking at your sump pits, and any gaps or cracks around pipes. So the active soil depressurization, or ASD, is most effective, as you can see on the diagram, that it is going to be set up below your foundation, where it's going to collect that air, and then it's going to drive it all the way through that ventilation work and outside the home. And typically there'll be a fan to make sure that it's drawing air from the bottom of the house to the attic and into the environment where it'll be not as concentrated. So across Canada, residential survey of homes was done between 2009 and 2011, where 14,000 homes across Canada were tested. And here, about 95% of health regions that participated had homes tested above the Canadian guideline, and 7% of Canadians' homes had exceeded levels. So here we can see that the lowest level was found in BC, and Ontario had a 4.6% of homes at greater than 200 becquerel. So you can see that each province has those differences, especially with the soil types and conditions of their homes can be a factor. And there's no area in the country that is radon free. Yeah, so First Nation Inuit Health Branch had done a study in 2013, 2014, and we had 75 public buildings in 14 First Nation communities tested, and 75 buildings, only 3 buildings were tested high, which is good. And EPHOs followed up with the individual communities that had high radon levels to determine what the next steps were to reduce those levels in those buildings. National Building Code of Canada in 2010, they had major changes at that time, and it applies to all new housing. So new housing should have the polyethylene soil gas barrier required under the slab to help bring the air into a specific opening. Slab perimeter is sealed with an air barrier of the wall. All penetrations and mostly pipes are to be completely sealed surrounding them, and a sump pit covered required to be airtight. So when the community expresses an interest in surveying their housing, they can get a hold of us as environmental public health officers, especially if new homes are going in, or if they want some of those houses assessed. we can provide the recommendations if those levels are high, and provide that data as well. And that concludes my presentation. Hope you enjoyed it, and if there's any questions, we can definitely go through them now.
Actually, at this time, we have run out of time, so there will be no time for questions. We can postpone them and we'll put them up on the chat, and maybe you can answer them afterwards. But we want to acknowledge you, Jordan, and we will be sending you a First Nation print done by Daryl Big George that we'll be sending you. So tech team could put that up on the screen. That's what you will be receiving.
Awesome.
And a reminder to write down the code for prize is apply for this session. So write that down and put that into passport to prizes. And if you can please head to the bottom of the screen and fill out the 5 survey question for some session feedback, that'd be greatly appreciated. And please come back for 3 p.m. with Derek Starlight. Don't want to miss the comedy show. Thank you, Jordan.
Thank you.